Today I will be presenting my risk assessment project. My patient is a 63-year-old Japanese American male who is married and recently retired. For his medical assessment, he has a history of thyroid cancer. He had a thyroidectomy, hypothyroidism, hypertension, and xerostomia. He is taking levothyroxine for thyroid hormone replacement, and he is taking losartan and hydrochlorothiazide for his hypertension. His blood pressure is 115/85, which is elevated. His pulse is 62 beats per minute, and his respiration is 14 breaths per minute, which are both within normal limits. His BMI is 23.7, which is within a normal range, which makes him ASA2. Here are the intraoral photos that were taken at the first appointment. Now we will be looking at this patient's most recent FMX to find radiographic findings. Restorations show up as radiopaque, possible carious lesions show up as radiolucent. You can see horizontal bone loss. There is active periodontitis, which is indicated by a fuzziness around the bone, and there are also 3 rooted mandibular molars. It was interesting to find 3 rooted mandibular molars on this patient. After researching, it was found that these are genetic variations that are most commonly found in Asians. They may increase the risk of localized periodontitis, and clinicians should be aware of them while they're scaling. For the E&I exam, it was found that the patient has clicking and popping of his TMJ and deviation to the left when opening and closing his mouth. Intraorally, there was redness in the back of his throat, redness on his lower labial mucosa, and a white bite mark on his right cheek. After examining the gingiva, it can be seen that there are rolled borders, inflammation, blunted papillas, and recession focused on the lower anteriors. For his periodontal assessment, he had probing depths of 2 to 3 millimeters and some 4 to 5 millimeter pockets in the posterior sextans. He had recession of 1 to 2 millimeters focused in the anterior sextans. His clinical attachment loss was generally 3 to 4 millimeters. He has mobility on tooth number 12, 13, and 22. His plaque index was 68.1%. His marginal bleeding index was 48.3%, and his AAP is stage 2 periodontitis. For this patient's treatment plan, appointment 1 will include the initial periodontal assessment and intraoral photos. Appointment 2 will include oral hygiene instruction, nutritional recommendations, caries risk assessment, and plaque index with intraoral photos. At appointment 3, the right side of the mouth will be scaled. At appointment 4, the left side of the mouth will be scaled. And at appointment 5, the periodontal reevaluation will take place. Intraoral photos will be taken, and a plaque index will be taken with intraoral photos. For patient education, I recommended that he continues to eat a balanced diet and reduces snacking between meals. His caries risk was low, and for oral hygiene instruction, I recommended the modified Bass technique to help him to clean off all of that plaque, to floss using the C-shape technique every day, an interdental brush for areas where he has gaps in his teeth, and an alcohol-free fluoride rinse. Here are the intraoral photos that were taken at the re-evaluation appointment. At the re-evaluation appointment, it was found that the patient had reduced gingival inflammation, reduced bleeding, and reduced probing depths. His plaque index also improved from 68.1% at the initial appointment to 26.7%, which can be seen in these pictures to the right. The patient was compliant and followed my oral hygiene instruction and started to floss twice daily and used an interdental brush. For prevention, he started using fluoride rinse, and he also accepted fluoride varnish at his appointment. For nutrition, he wasn't so compliant and his diet got worse. due to COVID-19, and he also continued to snack between meals. For referrals, he went to see the dentist to have his intraoral findings examined, and he also obtained a night guard. For research findings, this patient has 3 rooted mandibular molars, which are common in Asians and increase risk for localized periodontitis. This correlates with his increased probing depths within the mandibular molars. He also experiences post-operative hypothyroidism and xerostomia, which are common in cancer treatment patients. This can change the saliva and increase the patient's risk for caries. He also experiences nocturnal bruxism, which can be worse than bruxism during the day. This is because the bite forces put on the teeth while unconscious are much greater than what the body would normally allow. This may be the cause of the mobility within this patient's mouth. This project taught me that the background, medical history, and lifestyle of a patient has a huge impact on their oral health. Through evaluation, patient education, and treatment, this patient was able to improve their oral hygiene. Patient compliance is also very important because even with regular dental hygiene treatment, if the patient is not willing to take care of their teeth at home, the improvement of their oral health will not be as great. This patient was very compliant with recommendations that were made to him, and as a result, his oral health and his smile were both improved.